Have you ever faced the dilemma of ethics in your practice? If yes, then this video is for you. Hi, I'm Dr. Kunal Banka, a prominent dentist, life coach, and author of the best-selling book, 30 Days Challenge. Now, today I'm going to talk about the ethical practices in dentistry and our fight with ourselves to do or to not to do. What happens is, when the patient walks in, so many times we have that ethical question, that moral question, that should we advise the patient to go for an implant, should we advise the patient to go for an RCT, we get more money for this procedure, we get less money for this procedure. All those questions keep bombarding us and then we are split into two. ये करना है, नहीं करना है. Should we do this procedure or should we not do the procedure and tell the patient that this is the right way? Well, what do I do? Friends, there is one principle which I am going to share with you today. This is the secret of our industry. The secret is that the more you run behind money, money runs farther away from you. Your decision, your consultation should never ever be influenced by money or the cost of the treatment. For example, if a patient comes in and you feel, or if the patient says that he can pay anything to get him cured, and then your mind starts playing games, you start thinking about implants and a lot of big things to do in that patient's mouth, but in reality only one small procedure, one small 500 rupees procedure or 1000 rupee procedure could have solved the problem. But we tend to ignore this, our brains tend to ignore this. So that is the ethical dilemma. Our money, our support system, our life, or the patient, ethical treatment for the patient. Well, I would always vote for the ethical treatment for the patient. Never ever prescribe a treatment for money. The more you start advising the right treatment, more money starts flowing in. So if you run behind the money, patient will agree once, but he will never ever refer 10 more patients to you. But if you correctly prescribe something to the patient once, he will refer 100 more patients to you. So where is the money? In the ethical treatment, right? So guys, always tell the patient to go for ethical treatment, because everything what we do ethically always pays off. Don't think about implant, don't think about root canals. First step, think in your brain, if it can be done by a small filling, if the tooth can be saved for a long time, do that. Whatever the patient says, don't pay heed to it, because patients don't know the treatment. They will just ask you to do something what they've heard about, what somebody else has got done. Patients will hear about that and then they'll ask you to do that. Don't do that. Always, because every patient is different. Every treatment is different. You have to take every treatment as a fresh treatment. So guys, start prescribing ethically. Start telling the patient the best treatment, not the most expensive or not the cheapest one. Some of us, we always think that the patient can't afford, and in spite of the fact that patient needs some treatment, we always tell them the cheapest one. It's our ethical, moral duty to tell the patient of all the options with all the various budgets, and then it's up to the patient to choose for the treatment. Never ever do the wrong treatment, or never ever do the treatment driven by money. Treatment should always be driven by science. So guys, I hope this solves a lot of problems for you. Start doing ethical practice from today.